Hi, my name is Christina. I'm a physical therapist and running coach at Zone Physical Therapy. And tonight we're going to talk about heel striking. Do we care about heel striking? So the answer is no, I don't. Typically. Sometimes we do in certain situations, which we'll chat about. But generally speaking, I'm not really looking to see if my runners heel strike. What I am looking for is to see if they overstride. So what overstriding is when our foot is landing way far out in front of our body, essentially, right? So if our foot is landing greater than 29 centimeters in front of the center of mass, so we'll just call it hips if you're looking at a video of yourself running, that's what we would consider overstriding. Why do we care about this? So this is ultimately just a very inefficient way to run. It's not inherently dangerous, but it is very inefficient. So when we're landing with our foot that far out in front of our body, we're spending way more time reaching than we are pushing back, okay? So what that means is we're leaving room on the table with our performance by not utilizing our posterior chain very well. So if you think about your posterior chain, your glutes, your hamstrings, your calves, those are some pretty strong and powerful muscles. And so if we're not taking advantage of them, we're just not going to be quite as efficient, and we're leaving performance there, easy to grab, right? So that's the number one reason that I care. Now, when we talk about injury, because everyone wants to talk about injury when it comes to running form, overstriding is not inherently going to cause you to be injured. But what it does do is it does increase stress on certain parts of your body, right? And stress isn't necessarily a bad thing, but when we tip the scale between stress on a certain body part and what it's able to tolerate, that's when we start to have some injury, right? So if we're overstriding and we've upped our mileage and we aren't getting enough sleep and we're not eating well, we're going to be getting closer and closer to that injured state, right? So if we can keep the scale as balanced as possible in our body by helping distribute forces evenly so that all parts of our body are trying to help while we're running and keep us moving and efficient, then I'm in favor of that. So I do think it's important to spend some time working on. So when we are overstriding, we tend to put a little bit more stress on certain body parts like the patellofemoral joints, the patellofemoral joint and the patellar tendon. So around your knee, if you're having some anterior knee pain, it's kind of that area that we're looking at. It can put some more stress on the tibia. Then that's like that shin bone, and then a couple muscles around there like your tib anterior and your tibialis posterior. So sometimes that can manifest as shin splints. So that should ring a few bells for some people out there because they're pretty common. I see quite a lot of those. It can put some more stress on your femur and your hamstrings and your plantar fascia and in the hip joint itself. So what overstriding does is it just kind of tips the scale more in that direction to putting more stress on those body parts than they need to be, right? So why has heel striking gotten such a bad rep? That's because when we overstride, it is more common to see someone hit the ground with their heel first, right? And when they land with their leg underneath their body, it's a little bit more common to see more of a midfoot or forefoot strike. But that doesn't mean that's how it works. It's very possible you land with your foot exactly where it needs to be, right underneath your body, and we're still hitting with the heel. And I don't really care most of the time. There are some exceptions. So there's never like a complete right or wrong way to run. It's just what do we need in that moment, right? So let's say I am working with someone with a calf strain and they typically run on their toes because they thought heel striking was the worst and they needed to learn how to run more on their toes. And now they're coming to see me with a calf strain, right? I may I might spend some time trying to get them to spend a little bit more time off of their toes, even further back, maybe towards the heel while they're trying to run. And we're trying to rebuild some calf strength just to offload those muscles until they're back to their normal capacity, right? That way they're able to keep running as we go. Might see that with someone with like an Achilles tendon issue, or maybe I have somebody coming in with plantar fasciitis and they tend to hit their heel on the ground as they run. So then I might encourage them to stay away from heel striking. It just depends on the case. But generally speaking, I don't really care if someone's heel striking. I do care about where their foot lands in relation to their body. I don't think it's like a death sentence to being injured, but I do think there are some factors to consider there, and they might be tipping the scale a little bit in the direction of some overuse injuries and things of that nature. But everybody's going to run a little bit differently, and there are lots of different situations. So if you have any questions, you can leave a comment, send us an email, call us, whatever, and we can kind of look at your case specifically. So let us know if you have any questions. Again, I'm Christina with Zone Physical Therapy. Have a great evening, guys.